Ladies and gentlemen, please take your seats. Our program is about to begin. And now, please welcome this afternoon's MC, former state auditor and member of the New Mexico Commission of Public Records and NALEO First Vice President, the Honorable Brian Colon.
Hey, I thought it was gonna be Shakira, Your Hips Don't Lie was my walk-up music. What happened with that? Las mujeres. Hey, ladies and gentlemen, please take your seats. We're gonna get this great luncheon started for you. And I'm thrilled to be with you today. We're glad to have you back for a very, very special program at NALEO's 42nd Annual Convention and this Leadership Luncheon. You know, I want to just start out by saying this. If you were here for the plenary this morning, you have served some very special leaders. And one of the things that I wanted to impart as we got started at this luncheon was to have you reflect on that school board leader, Jose Magaña. Because Jose Magaña did something that we all need to do in our communities every day, and that is tell our story. The lens he looks through is critical for his community. He shared it with us today, and he is modeling the behavior that we all have the privilege of doing in our communities as Latino leaders. So, Mr. Magaña, the Honorable, I just want to say thank you for your time up here on the stage this morning. You crushed it. Give him another round of applause for he and his colleagues. It is a privilege to serve as your vice president, and you know, I know that the Puerto Ricans already got the shout out this morning, so I'm not going to give them a shout out, but if I was going to give the Puerto Ricans a shout out, it'd be right now. Huepa! And I know that you know that the bolo tie comes from New Mexico with our indigenous heritage and people, so I'm not going to give New Mexico a special shout out, but if I was going to, it would be right now. I know I got my assessor here. We are thrilled to have you with us, and today, the next speaker is somebody who I respect a great deal. He's been a friend and a colleague for almost 20 years now. And what you should know about Javier when he comes up here, Javier Angulo is an incredible Latino leader. Folks, this does not happen without our sponsors. This morning I had the privilege of sitting with the leaders at State Farm, but this afternoon I get to introduce somebody who's not just a Latino leader who talks about equity, who talks about access to health care, access in community, seats at the table for people of color. He's not just here at NALEO, because Javier Angulo is NALEO. 20 years ago, 15 years ago, he was working right here on the NALEO team that you love so much today. But he hasn't forgotten from where he came, because he has said Walmart that's in communities all over our country will continue to stand with his organization. In easy times and not as easy times, Walmart has shown up for more than 20 years. They're the only retail sponsor this year, and I want to ask you to give it up for NALEO's own, who's grown up to be at the big kids table at Walmart, the retailer who's supporting this conference, Don Javier Angulo!
That's awesome. Buenas tardes. Buenas tardes todos. Wow, what an introduction. I hopefully somebody recorded that, because I need to have that in my bio. No, de verdad, it's such a great time to be here with all of you. Todos son familia. Todos ustedes son familia. It's always good to be home. So muchas gracias. So it's an honor to be here today with all of you at NALEO, a space where Latino voices are lifted, stories are shared, and communities are celebrated. At Walmart, we recognize that our Latino associates are at the heart of our business. Our associates bring resilience, innovation, and a deep sense of community to everything we do. We understand that many in our community are currently facing uncertainty and fear, especially in light of recent immigration actions and emotional toll they bring to the community. Let me be clear. Walmart stands with you and all of our associates. We are committed to being a place where every associate feels safe, valued, and supported, regardless of background. We are here not just as an employer, but as a partner in their journey. So, for example, we offer U.S. citizenship courses and ESL courses to all of our associates free of charge, in addition to a free college education. So I just want to share a shining example of success from our education and skill development programs, and that's Liz Cardenas. Liz joined Walmart in 2022 as an automation equipment operator at our distribution center in Lancaster, Texas. Where's Texas? Texas. Last year, Liz took a leap of faith and applied for the Walmart Associate to Technician program. This program is designed to empower our associates by providing them with the hands-on skills needed to excel in maintenance technician roles. The best part? No prior maintenance experience is necessary, just a passion for learning and growth. Liz found that the program not only opened doors for her, but also provided her with invaluable problem-solving opportunities. Despite initial doubts about entering a traditionally male-dominated field, Liz discovered that the A2T program welcomes all associates regardless of their background. So Liz's journey is a testament to the program's inclusivity and effectiveness. She encourages others to embrace this opportunity, sharing that she had no prior experience with tools, but was taught everything she needed to know from the ground up. Today, Liz confidently applies her new skills both at work and at home, providing that the sky is a true limit at Walmart. We also support our associates beyond our education and skill development programs. We know these times are very difficult and emotionally heavy. That's why we have expanded access to mental health services for all of our associates and their families so they can find strength, healing, and connection. Whether it's through counseling, peer support, or simply having someone to talk to, we let our associates know that they are not alone. Together, we will continue to build a workplace and a world where dignity, compassion, and opportunity are not just ideals, but everyday realities. Muchas gracias por todos. Muchas gracias for your leadership, courage, and above all else, your trust. Gracias.
Let me just say that Walmart has been fortunate to have Don Javier there for 13 years, and it's great to have him at the table leading with Naleo again with a corporate sponsorship. Thank you. One more round of applause for Javier Angulo. We are grateful for Walmart's continued support for 2 decades and more. Now it's my honor to introduce, to come to us by video, an incredible leader in the United States Senator, U.S. Senator Raphael Warnock of Georgia. Senator, take it away.
Hello, National Association of Latino elected and appointed officials. I'm United States Senator Reverend Raphael Warnock, and I am so thrilled to help welcome you to the 42nd NALEO Conference and to the great city of Atlanta, Georgia. NALEO is home to Latino leaders and officials from all walks of life, and I couldn't be prouder and happier that Georgia, with one of the largest Latino populations in the country, is hosting this year's conference. You are bringing everything that this storied organization stands for to the Peach State during a truly unprecedented time in our country. More than ever, we need one another. Even if we have some setbacks in the short term, I still believe that Dr. King is right. The arc of the moral universe is long, but it bends toward justice. And NALEO has been bending that arc. So thank you for all that you do and everything you represent. Enjoy this year's conference, keep the faith, and keep looking up.
All right, how about a round of applause for United States Senator Raphael Warnock. Thank you, Senator. We've got one more video message for you. because let it not be said that Naleo attracts the best. When they can't be here in person, they always call in. And we want to say thank you to Senator Ossoff for doing the same. So Senator Ossoff, take it away.
The National Association of Latino Elected and Appointed Officials, this is U.S. Senator John Ossoff. It is such a pleasure to welcome you to Atlanta for your 42nd annual conference. We are pleased that you've picked the Peach State in our capital city to host this event, and it is my honor to work alongside so many of my colleagues who are your members in the state of Georgia. I hope it is a fruitful and productive conference. It is my honor as well to represent Georgia's Latino community, and my goal since I was elected has been to be the most responsive and effective and visible federal representative that Georgia's Latino community has ever had. If ever my office can be of any service to any of you, just reach out at ossoff.senate.gov. Again, this is U.S. Senator John Ossoff welcoming you to the great state of Georgia.
Round of applause for Senator Ossoff. So for those of you that are Naleo alum and that you've been to these luncheons before, you know that we're not quick to give out a lot of awards. We celebrate the collective impact of Latino leaders from around the country, and quite frankly, all of you are worthy of celebration. But at this moment, I'm going to ask you to be still with me as we reflect on awarding somebody with the Naleo President's Award. And this award represents integrity, service, persistence, leadership, all that is good when we are at our best. Somebody's trying to clink a glass. It didn't work. Qué bárbaro. Gracias, jefe. They don't listen to me or you. I was trying to be all serious, and then look what happened. But this is serious, and when you see who the recipient's going to be, I know you're going to be rising to your feet. But we, at this moment in time, have had some great leaders that I've had the privilege of serving beside as your vice president. And the President's Award this year, as is done in the past, will be presented by the President of Naleo. She's also a council member of Downey there in California. And she is putting in the effort. She's putting in the jale. You want to know what it is to roll up the sleeves and get the work done? I've seen her do it daily. It's been a privilege to be her vice president, your vice president. Please turn your attention to the Honorable President of Naleo, council member of the city of Downey, California, the Honorable Claudia Frometa.
Can we give our Honorable Vice President Brian Colon a round of applause, please? It is my distinct pleasure to serve alongside Brian and so many dedicated individuals. Brian is great. It is also, ladies and gentlemen, my distinct honor to present the 2025 Naleo President's Award. This is one of our organization's highest recognitions to a leader whose vision, dedication, and service have profoundly shaped Latino engagement and political progress in this country. For 3 decades of service to Naleo and Naleo Educational Fund, El Jefe Arturo Vargas, as we remember, for 30 years, for 3 decades, Arturo has guided NALEO's mission to strengthen our American democracy by promoting the full participation of Latinos in civic life. Under Arturo's leadership, NALEO became a premier, nonpartisan convener of Latino leaders, expanding its network, deepening its impact, and ensuring that the Latino voices were heard in every corner of the nation. Arturo's unwavering commitment to civic participation and leadership development has left a profound mark on our community and on our country. Once again, I'd like to take a moment and direct our attention to the screens for a special video in honor of Arturo Vargas.
Oh my goodness, what can I say? Arturo is the best, el jefe.
Well, to my friend Arturo, I say thank you first and foremost for giving so much of your life and your energy to the advancement, the growth of NALEO.
We know that you have sacrificed and given so much to this organization.
Thank you, Arturo, for all your leadership, for your guidance, and for your friendship, and for really bringing the NALEO family and the Latino political community nationally to have the impact that it's had in all aspects of democracy. We wouldn't be here without you.
I'm extremely proud of the work that the organization has done under Arturo's leadership and the leadership of my colleagues to develop programming and initiatives that support the success of Latino public servants.
And there are very few people in this country that can say they have had the impact that Arturo Vargas has had over these many decades of leadership.
When I think of Arturo, I think of him as a great leader, very intelligent, attuned to what was happening in our communities. Arturo's influence has been so significant for this organization, and his ability to connect with people.
And from my perspective, he's served as a mentor to myself and to many other elected officials.
We are better people because of your service to this organization, and I am forever grateful, Arturo.
It is really an extraordinary legacy and one that makes me very proud to call Arturo a friend.
Arturo, we love you, and we just want to say thank you.
Thank you for everything that you have given to this community and for what you've given to me personally.
I will always be fond of NALEO because of Arturo. I will always be part of the NALEO family, and Arturo will always be my comandante.
Now, would you please join me in welcoming to the stage with a big, thunderous round of applause the 2025 NALEO President's Award recipient, Arturo Vargas.
Buenas tardes. How's everybody doing? This is the first NALEO conference in 29 years. I did not have the opportunity to say welcome to the NALEO 42nd Annual Conference. But welcome to the NALEO 42nd Annual Conference. So thank you, President Prometa, and all who have served in the office of NALEO President. Especially NALEO's second president, the Honorable Raymond Sanchez, then Speaker of the House of Representatives of New Mexico, who established this award, the NALEO President's Award, and was one of my strongest supporters in my first years as executive director. You know, I must express my personal thank you to the leaders in our community who were instrumental in me being considered and then hired to be NALEO's third executive director back in 1994. So I say personally thank you to Alberto Pimentel. He was the search firm consultant for Korn Ferry, and he's very proud of the fact he worked on this search because that was his first placement ever in his career. To Rita DiMartino, who was then an AT&T executive, vice chair of the New York State Republican Party, a NALEO board member who insisted that I be recruited for this position. To Jesus Garcia, then Chicago alderman, and now a member of Congress. He was a key member of the search committee at that time, so I blame him. And my boss at the time, Maldiv President and General Counsel Antonia Hernandez, who gave me the most important advice that I have heeded. When it was becoming evident that this may actually happen, I went to her office with a heavy question on my mind. Is the Latino community ready for a gay man to lead one of its national institutions? And she looked me right in the eye and said, yes, and don't you ever let that stop you. And it never has. And to Congressman Everett Roybal and Dr. Harry Pachon, then NALEO President and NALEO Educational Fund board chairs, who were willing to entrust this enterprise to a 32-year-old mocoso. There is so much that we collectively achieved over these past 3 decades to promote the full participation of Latinos in the American political process, from citizenship to public service, that it's impossible to try to mention even just our most impactful accomplishments. Helping hundreds of thousands of lawful permanent residents apply for and become U.S. citizens. Helping millions of Latinos to vote and be counted in the census. Supporting our Latino public servants to be more effective policymakers. Advocating for policies and practices to make civic engagement more accessible to Latinos and all Americans, and preventing efforts to make Latino civic participation more difficult. I hope there will be students of American history and political science with the curiosity to study and record the actions and impact of NALEO, NALEO Educational Fund, our staff, boards of directors, and members, the achievements of the past and those yet to come, and that this history will help tell a more complete story of the American experience, and that this story may be included in the Smithsonian Museum of the American Latino that must one day rightfully sit on the National Mall. Now, as remarkable as advancing the NALEO mission has been, something more profound happened over the past 30 years. We experienced life. Legions of NALEO Educational Fund staff and board members lived the human condition in all its complexities. We experienced triumph and defeat, happiness and sorrow, joy and grief, love and heartbreak. At least 4 of our colleagues who met while on staff fell in love and married. Evan and Gladys, Marcelo and Maria. Well, at least 4 that I know about. Because apparently a lot went on under my nose without, me finding out. And there are so many NALEO love stories, such as Arizona State Representative Juan Carlos Escamilla, who met Utah State Senator Luz Robles at a NALEO event and proposed marriage to her on the floor of the Utah State Senate 11 years ago. So be careful out there. There's a lot that goes on at these conferences. So over the past 30 years, we celebrated weddings, including my own to Judge Michael Fitzgerald. We rejoiced in the miracle of the births of children and shared our grief when family members passed on. Such as 18 years ago, when Karen Pina, Erica Bernal Martinez, and I each buried our fathers within just a span of a few months. We sought each other's comfort when members of our own NALEO family passed on, often at too young an age. Our colleagues Lloyd Montserrat, Miguel Huitzil, Arabel Hernandez, Steve Blank, and Karen Pina. And leaders and members of our boards, Congressman Roybal, Congressman Ed Pastor, Dr. Patron, Governor Bill Richardson, Supervisor Gloria Molina, Trustee Maria Cali, among others. Throughout it all, it has been a singular honor to be in the leadership role of NALEO and NALEO Educational Fund over the past 3 decades, and to share these experiences with my colleagues as we worked every day to advance our mission. It is, after all, the reason we came to work at NALEO, and that all of you have chosen to be part of this network of leaders, to ensure that everyone has the unalienable human right to live to live life in all its dimensions, to develop one's full potential, and to contribute to helping this country live up to its ideals and principles. Never has the work been more necessary and indispensable than at this moment in our nation's history. I deeply appreciate this recognition today and hope that I am as worthy of the meaning as its prior recipients. Over the years, I have often said to my colleagues that NALEO is merely a vehicle. It is the destination of achieving full Latino political integration that matters. When we came aboard, we were entrusted with its operations and that it stay on course. Eventually, each of us will need to step off this vehicle and allow others to continue that journey. I am so proud of the NALEO Educational Fund staff alumni who have gone on to have extraordinary careers, many making their marks in philanthropy, in corporate America, some leading their own nonprofit organizations, and others becoming elected and appointed officials themselves. You know, one of the first people that I recruited to NALEO, Marcelo Gaete, had an interesting way of trying to convince people to come work here. You're not going to get rich at NALEO, but you will at your next job. Waiting for my next job. So the time has come for me to step off. Almost. I am grateful to the NALEO Educational Fund Board of Directors and to Erica, who have agreed to allow me to continue to contribute for now as senior advisor. I cannot think of anyone better prepared or qualified to take hold of the NALEO steering wheel than Erica Bernal Martinez. I did not need to pass the baton. She was holding it. So thank you, everyone, once again for this honor. and for the privilege and adventure of the past 30 years. I am indebted to your engagement, to your support, and to your affection. Gracias.
Once again, please join me in congratulating our dear Arturo Vargas on this well-deserved honor. Let's give him a round of applause, please. Arturo, your vision and leadership have shaped not only this organization. I want to have him come up. Can we have him come up again? Your leadership has shaped not just this organization, but an entire generation of Latinos. I remember coming here as an immigrant at the age of 14 years old, and when I began high school, I was so interested in politics and civic engagement. And at the time, one of the first magazines that I was able to buy with my domingo was a Hispanic business magazine. And I remember coming across an article on Naleo, and an article where you were also photographed. And this was clearly many years ago. I say it with all my endearment.
Did it have hair?
Maybe a little. But I was so touched, and since then, I looked up to you. I looked up to the work that you did. I looked up to Naleo and the people that you brought together as a nonpartisan yet bipartisan organization where dialogue could occur. And as policymakers, we can bring change to this great nation. And Arturo, you've made all this happen over the years. And I just want to say thank you from the bottom of my heart. You're a great leader, and we appreciate you.
Thank you so much.
We now turn to this afternoon's plenary discussion, Federal Reforms to Medicaid. This timely conversation will examine the national landscape of Medicaid policy and the urgent reforms needed to better serve our communities, especially in the face of widening challenges around healthcare access. We are honored today to be joined by a trusted partner in this line of work, Kaiser Permanente, who is serving as today's plenary host. Representing Kaiser Permanente and joining us for this conversation is Ms. Ceci Oregon, Executive Director of Kaiser Permanente Institute for Health Policy. And now, to guide this critical discussion, please welcome our moderator, Utah State Senator, Minority Leader, the Honorable Luz Escamilla. Join me in giving her a round of applause before she welcomes our plenary guests.
Gracias. Buenas tardes. Muchas gracias, Presidenta Frometa, for those beautiful remarks. It's a great pleasure for me to be here. I'm going to sit here and get ready for the conversation. Everyone, welcome. And Arturo Vargas me hizo ponerme roja, so thank you for that. It's a great pleasure for me to be here at the NALEO 42nd Annual Conference, and I'm pleased to be part of this timely and critical conversation to learn from experts joining us today on this federal reform to Medicaid luncheon. More than 70 million Americans, about 1/5 of our nation's population, rely on Medicaid for their health care. During this plenary session, we will hear from experts who will provide an overview of the Medicaid landscape and the impact of federal legislation on state, local, and school board as well governments, the economy, and the provisions of healthcare for most of our vulnerable populations. We will also talk about options. What do we do next? What is available for us in our different capacities? And, just to begin, the Kaiser Family Foundation estimates that the Senate reconciliation bill will reduce federal Medicaid spending by $1 trillion, with a T, over the next 10 years. That's about 15% of our Medicaid spending during the same time. So just pause on your budget brains. Let's move them there. I hate to, do this while you're eating. You're probably indigestion after this. I want you also to think about what's going to happen with the ACA, the marketplace. The new plans just came in, and the insurers are asking for an increase, the biggest increase in premiums in the last 5 years. Here we are now with more budget cuts in there. And according to the Congressional Budget Office, an estimate of 12 million people will become uninsured by 2034 because of all these changes. So with that in place, please help me in welcoming today's our experts this afternoon. We're going to start with Kate McAvoy, which is the Executive Director at the National Association of Medicaid Directors, Cecilia Oregon, Executive Director at the Kaiser Permanente Institute for Health Policy, and Edwin Park, Research Professor at the McCourt School of Public Policy, Center for Children and Families at Georgetown University. If you get a chance to read their impressive resumes, they're all in our bios in their conference. Their bios are in the conference mobile app. So take a look at it. It's incredible, the caliber of speakers that we have this afternoon. So thank you all for being here and joining me this afternoon. We'll start with Ms. Kate McAvoy. Like I said, she is the Executive Director for the National Association of Medicaid Directors. And for all state legislators, if you want to have a critical relationship you want to build, it's certainly with a Medicaid director at your state. But if you don't mind introducing yourself and maybe give us an overview of what the National Association of Medicaid Directors do and your role and how it has been changing with all this information and all the changes to Medicaid, please.
Senator, good afternoon, and thank you so much for the honor of joining this incredible panel. I'm Kate McAvoy, and I serve as the Executive Director of the National Association of Medicaid Directors, as the Senator mentioned. Like NALEO, we are a nonpartisan association that represents the 56 state and territory Medicaid programs. The applied working partnership between the federal government and states and territories that brings Medicaid to life on a day-to-day basis, as it is variously interpreted across the country. Our reason for being is to support not only the 56 directors, but also over 500 members of their senior leadership teams. We operate affinity groups and convenings that connect directors, chief financial officers, eligibility leaders, folks who are involved in the systems work and the member engagement aspects of the program, and all to the end of sharing best practice and also raising up and leading up to the federal government in terms of the practice of Medicaid.
Excellent. Well, thank you. And Kate, thank you for being here. And we know right now with all the changes, we're eager to hear more of how your organization is preparing to be a partner, as you said, with all of our directors that are, I'm sure, a little bit overwhelmed with everything. Our next speaker today is Ms. Cecilia Oregon, Executive Director of Kaiser Permanente Institute for Health Policy. If you don't mind introducing yourself, we know your Kaiser Permanente has always been a great partner for NALEO, so excited to have you here, Ms. Cecilia, please.
Thank you. Thank you. It's a pleasure to be here today. I'm happy to share a little bit about Kaiser Permanente for those of you that may not be familiar with our system. We are a fully integrated healthcare delivery system, and we serve about 12.6 million folks in the country. with about 1.5 million of those being Medicaid members. We operate in California, here in Georgia, Oregon, Washington, Hawaii, Colorado, Virginia, DC, and Maryland. We employ about 25,000 physicians in our Permanente medical groups, almost 80,000 nurses, and operate 40 hospitals and over 600 medical facilities. I run our Institute for Health Policy, which is part of our National Government Relations Department, and our goal is to inform public policy with the evidence and experience of Kaiser Permanente. Happy to be here.
Thank you. Well, Mr. Edwin Park, research professor at the Center for Children and Families, Georgetown University. Please introduce yourself.
Thank you, Senator. Thank you for having me. So, the Center for Children and Families is a research center located within the McCourt School of Public Policy at Georgetown University, where focus is on ensuring that children and families have access to affordable, high-quality health coverage. We provide research and analysis. We provide technical assistance to policymakers. We offer solutions to try to improve coverage and access for our nation's children. We also work very closely with state child health advocates across a number of states who work on similar issues.
Excellent. Well, you can see just incredible feedback we're going to receive through this process. We'll start with you, Kate, and I'll go by first names now. And if you don't mind helping us just ground our conversation, obviously Medicaid is a very complex issue, but just give us a very high-level overview of what Medicaid is and its recent history and all the changes. And of course, as we are now moving into this new federal legislation, what does that expansion or non-expansion states look like with the new changes?
Yeah, I do think it's incredibly important to be aware of the recent history of the Medicaid program as it influences our current moment. Obviously, we've had a huge period of development and growth for the program since the implementation of the Affordable Care Act. We saw significant expansion of the participation in the program, layering of additional features of coverage, optional services, and a thread of innovation that really drew in different elements like health-related social needs, attention to people in justice settings. That burgeoned over a period of over 10 years. Came up against our experience in the pandemic, obviously an incredibly taxing set of events for everyone nationally, but really enabled Medicaid to shine as it is designed to do, to scale up very rapidly, to serve those who are displaced by unemployment, and also preserve coverage. And you saw a lot of attention with Congress in the continuous coverage of people on Medicaid. And then the events following the pandemic, the adjudication of eligibility for everyone, the so-called unwinding process, extremely intense, and I think that's been the dynamic for over 10 years. Intensity, growth, development. We are now grappling, obviously, with a different policy landscape, the implementation challenges of the OBBBA. And really what I want to wind up by saying is we're conscious as an association, there's not just one theory of social change or interpretation of Medicaid across the country. That is quite variable across the 56 programs. That is a very significant influencer on how states will be looking at the OBBBA, depending on whether you're an expansion state, depending on whether you're a state that is investing additional resources and services, or more adhering to the standards that are established federally. All these are influencing factors. States are really focusing on staging of the engagement with members, the eligibility changes that are required to be made, especially in expansion states, and finally, modeling the fiscal impact of the contracting amount of federal supports. Those are really the center points of focus.
Thank you for that, Kate. And it's fair to say that the directors have been through a lot, many of them, through the pandemic, unwinding, which was pretty traumatic out of itself. Do you feel the directors overall in your association are ready to implement this new legislation?
There is an intense mission focus across the country. I mean, Medicaid directors' reason for being is to ensure that both that there is service to, as you said, the over 70 million people served by the program, but also that accountability, the stewardship of public resources. Medicaid is approximately 29% of most states' spending. It's a huge part of the footprint of that financial landscape. So those two things paired together with the implications of reduced financial support from the federal government really do inform the work ahead.
Excellent, thank you. And to all my colleagues, I mean, I know many of you are state legislators, others are in local government. Many of our municipalities in different states also run some of the, the state becomes a pass-through, it goes to local municipalities for mental health. So we know all of you may have a different view or lens in terms of the Medicaid role in your budget, but 29, you're correct, about 29% in average. That's a big portion of our state budget, so keep that in mind as we continue this conversation. Thank you, Kate. Cecilia, in terms of this new legislation and overall national healthcare landscape for an organization as large as Kaiser Permanente and the big impact that they have in our communities, and your focus on vulnerable populations, what does this new legislation mean for those communities, hospitals, and community health centers specifically?
Yes, so Kaiser Permanente, we work very closely with safety net organizations in our footprint. So public hospitals, community clinics and health centers, and school-based health centers as well. And I think that the reduction in Medicaid eligibility and some of the cuts that we'll be seeing will have a really dramatic impact on a number of those institutions that are really serving the populations that we are all care about. So it's anticipated that there will be hospital closures, especially in rural areas, and for community clinics and health centers, for example, that have been trying to work towards establishing more prevention-oriented and coordinated care. We might be looking at a situation where folks delay receiving services, delay receiving preventative services, are seeking care when they are sicker, and therefore those types of services and supports tend to be more expensive, again, when you're receiving them when you tend to be sicker. So we are looking at a pretty dramatic shift in the landscape for our safety net organizations, as well as healthcare providers like Kaiser Permanente that sees Medicaid populations as well.
And what about the workforce? I mean, you are a large employer. You mentioned the number of some of your physicians or medical healthcare providers on your payroll. With all these new changes, what does that look for our healthcare workforce, and how do we prepare ourselves as elected officials, right? Because they're going to come back to us with questions and demands.
Absolutely. We are anticipating a pretty dramatic impact to the healthcare workforce, and in particular in communities where it's a hospital and the local economy might really revolve around a local hospital or facilities. We think that the impact is going to be not just to healthcare providers, nurses, et cetera, but actually to all of the economy surrounding those facilities as well, restaurants and other types of services and supports that people seek when they are seeking services locally, and especially in rural communities again.
Thank you for that, Cecilia. Edwin, as we see the new changes on the federal law, for you in your policy perspective, what are those changes for the Medicaid recipients look like in terms of their coverage and access? What are some changes that we should expect so we can talk to our constituents?
Yeah, unfortunately, the budget reconciliation law, which the president signed on July 4th, is the largest cut in Medicaid history. It's almost $1 trillion in cuts, another $200 billion in cuts to the marketplace subsidies. Once you take into account how the provisions interact, it's a cut in healthcare of about $1.1 trillion over the next 10 years. And there's going to be a lot of Medicaid beneficiaries who are going to lose coverage. We don't have updated numbers yet for the final legislation, but what the Congressional Budget Office issued yesterday was an estimate that there'll be 10 million more uninsured by 2034. If you take into account other actions or omissions like the failure to extend the expiring enhanced tax credits for marketplace plans under Obamacare, you're talking about a 15 million increase. So this is going to be the largest rollback in health coverage in history as well. So what Medicaid beneficiaries unfortunately will face will be reduced eligibility, so no longer having access to Medicaid, going uninsured. And then those who retain that coverage may have higher out-of-pocket costs, less access to covered benefits, and then fewer providers to access to get the care they need for themselves or their families, because hospitals, nursing homes, other healthcare providers will be unable to keep their doors open, or if they do keep their doors open, with reduced services, reduced staffing.
And one of the things we keep on hearing, and I'm sure all of you have heard, is this work requirements. Right. And we're hearing, this is a lot of media coverage on these work requirements, not that they were not there before, it depended on states. What are the new changes into work requirements, and how does that look for many Americans?
Sure, so near all states that have taken up the Affordable Care Act Medicaid expansion will have to now institute mandatory work reporting requirements for those enrolled through the Medicaid expansion. We don't have the updated numbers, but roughly 5 million people are going to lose their Medicaid coverage as a result, of which nearly all of them are going to end up uninsured. And it's not because they're not working. 92% of those who are expansion adults who are on Medicaid today, they either work or they're caregivers, they have chronic conditions or disabilities, or they're in school. But it's because they can't navigate the bureaucratic systems necessary to report work or to qualify for the exemptions to which they're eligible for. And so research shows that those states that have experimented with these kind of Medicaid work requirements, there was no increase in hours worked or in employment. It was rather disenrolling people who unfortunately remain eligible but couldn't make it through the burdensome process. So this is going to be quite harmful for the expansion, and many adults can lose coverage, and it also could likely result in their kids losing coverage, because we know that when their parents are covered, eligible kids in Medicaid and the Children's Health Insurance Program are also more likely to enroll.
And that's a great segue to our next part of the conversation, that is, as elected officials, and in our community, a Latino, Hispanic community, there's a very large uninsurance rate. Many of them is not that they don't qualify, it's that almost you need a PhD to apply for Medicaid. I mean, there's a joke about the level of intensity, and now with this new work requirements, like you said, it's gonna be the process of also semi-annual, every 6 months, having to review your income, and all of that is time, is process, sometimes maybe language barriers. In some states, they're reducing access to some language access as well. So we're gonna see a lot of our gente, mucha de nuestra comunidad, impacted by these new operational changes that you may say, well, they're not removing the access, it's just, they're just making it more difficult. So, Kate, how does that look like for operations for the Medicaid directors, right? I mean, is this going to be more staff for them? And is that going to come to the state budget request right? I mean, all of it translates to who's going to pay for those changes at the end of the day?
Yeah, it's a great question. And I do think for all of you in the audience, there really is a set of opportunities. First, to be cued about the needs of your own environment, what is going to be the demands in the near term. I think the first central question is, are you an expansion state or are you a non-expansion state? That's going to be very determinative of the obligations of the OBBBA, particularly around work requirements, the more frequent eligibility checks, the requirements around cost sharing. These will definitely require major staging efforts in terms of engagement with members to equip them to understand the obligations. Also systems work that is difficult and costly. It's extensive. For electeds and other policymakers, I think a really important consideration is, can we analogize to the work that we collectively did during the unwinding when we were adjudicating the eligibility of every single person on the Medicaid program, the attention not only to seeing and connecting with the member where she or he resides in a language and in a medium and through a trusted advisor that will help convey information, activating community partnerships, both with providers and also advocates, thinking about that and the ways that state resources could support and underwrite those costs, because there is not provision in the federal law for that type of outreach. Similarly, there is some support for states for systems changes for these very important considerations, but it will not be adequate to cover the entirety of those costs. So examining, again, out of general funds or other sources, philanthropic funding, is there ways to support that work and also to enable partnerships across Medicaid programs so that we are not spending first dollar on a state-by-state basis. We're using regional approaches, or as we prefer through NEMD, advocating to the federal government for use of central business standards that will enable us to be more efficient and effective and not navigate this on a state-by-state basis. Finally, I think it is extremely important to understand that Medicaid directors and their chief financial officers have done extensive modeling on financial impact. It would be very important to reach out laterally and be connected so you don't feel like you have to replicate that type of analysis. What does that mean for implications for the amount of federal revenue that is coming into your state or territory? What does that mean in terms of considerations of use of general fund or other resources? These are the things that I think will be very important to examine in advance of the 2026 legislative session.
Those are great remarks. And Cecilia, in this whole process of partnerships, and you mentioned, Kate was mentioning the adequate individuals to communicate, and for me, it's code for community health workers. Our CHWs do great work in being brokers, cultural brokers on some of the systems. The ACA alone taught us what it takes to re-educate a whole population on access to care. Cecilia, how does that look for an organization with the footprint that you have to now implement all this, be kind of like the impacted on the implementation of programs like this?
Right. I think Kate said it very well, which is these changes are happening at the individual state levels and in many cases then at the county levels. Mm-hmm. So the amount of modifications that need to happen administratively really wind up rolling down in many cases to the local level, and then working individually with the providers, health plans, et cetera, to try and make all those changes happen. So it's a cascading amount of complexity, I think, that needs to be navigated. So for a system like Kaiser Permanente, we, in California, we operate in over 30 of our counties, and each of those counties really requires a nuance and a dedication to really understanding the way that county is executing on those changes. And I think that would be true for the states that we operate in outside of California as well.
So huge impact, and to, again, all of our colleagues, I want to even bring it more local to school board levels, because I know we have school board members here, and the impact on children. And I think, Edwin, you mentioned that correlation between a child being covered and then parents and families. It's hard. We at length, run legislation to cover all children, which in Utah, we're very fortunate to have that. It's hard because you may have families with mixed status families that have one child covered, another one is not covered. The stories are heartbreaking. With all these changes, we now may have more people dropping out of the rolls of Medicaid. What as a school board, they should be prepping for seeing impact into their education systems and schools. What would you say are some of the concerns, and what can they do to be more proactive preparing for this?
Yeah, I think research shows that kids on Medicaid, obviously they get access to health care as a child, but they're more likely to have higher educational attainment, finishing high school, going on to a 4-year college, having better health in adulthood, less risk of disability, higher income, greater financial security as adults. And so it's going to be critical in terms of outreach and enrollment for school officials, to advocate, to try to mitigate, some of the harm from this legislation. You can't mitigate all of it away or even most of it, but, one of the things that can be done is ensuring that the states, for example, in implementing some of these proposals, takes what flexibility is given to them to try to make it less burdensome for individuals and families to get coverage. And that's going to be critical. Another provision affects Medicaid financing, but ensuring that as the federal government restricts some of that financing, the state is able to identify other financing sources elsewhere, and local officials, including school officials, can be partners and advocates for that.
Kate, and one of the things I want to maybe move in, I like this segue to the idea of innovation and what does it look for, school board members, local governments, and state government trying to work all together and having, this idea of communication, because the states were probably going to be the ones in our next, legislative sessions or special sessions. Many of us are going to go to special sessions to deal with some of that impact. Yesterday, I guess the governor of Georgia, as we were here celebrating this conference, announced that they're putting a freeze on all their budgets, just in impact, waiting for the impact to see what they're going to do with some of the budget cuts, and that includes all of the Department of Education. That's another plenary session, I'm sure, to talk about in the hundreds of millions of dollars. How can we make sure that we don't lose innovation and the thinking outside the box to find solutions when we feel so much restriction from the federal, the federal government being a huge partner on the Medicaid, access to Medicaid. And, we've been through the trauma of COVID, unwinding, so we're not new to having to solve problems. How do we not stop innovation? What do we do to keep moving towards more innovation? Kate.
It's a wonderful question. As I referenced at the top of our conversation, a thread for Medicaid over the last 10 years that's been just remarkable is that innovation across all 56 programs. Used to be the case that there was a small handful of states that used demonstration waivers, and we're at the vanguard. That is just burgeoned so that nearly every state and territory has used at least one 1115 demonstration, applying that in locally relevant ways, whether that is around health-related social needs, support for just to serve people, or if it's really around optimizing processes to better serve people, for instance, eligibility. And I just want to make sure to say it is no longer a conservative or a liberal phenomenon. Each state is really activated around that in terms of making its program better in its own footprint. The piece that I want to start by saying is that there is opportunity for all of us, especially in the expansion states that are implementing facets of OBBBA, the work requirements, to do that in the most efficient and effective way, especially from a cost standpoint. I mentioned just a minute ago about using common standards across all the states that have to do this. That's a way of saving money and investments in, for instance, the consultancies that do that work. Also a way of saving money is boosting the number of people whose eligibility is redetermined using automated processes like ex parte. That was a big focus during the unwinding process. As electeds and appointeds, you can have a role in continuing to emphasize the need to do those sorts of things as efficiently as possible so that we are not spending money that could otherwise be used to create more value for members, to tailor the program. As we learn more about the Trump administration's priorities with 1115s, which we don't yet know very much about, that will ensure that there's some resources at the state level to continue to do that. And I think we have to remain alert. The last thing I'll say is the first Trump administration approved the first HRN 1115 waivers in North Carolina. So I would just caution against making assumptions about exactly where we'll be with an agenda around innovation, even in context of the reality of the financial circumstances of the program.
Thank you. Cecilia, the same question. For someone, you guys you have to invest in infrastructure. Innovation is costly. How are you guys going to be looking into the future?
It's a really good question. And I do think for us, we tend to think at Kaiser Permanente that innovation is something that should help control cost, should help affordability for our members. And so it's an area that we are really actively looking at, in particular for our Medicaid populations. So we work closely with the states, closely with the counties around opportunities for innovative practices, whether that be working closely with schools, as we mentioned. We're also looking at opportunities to work with older adults in this space as well through Habitat Health opportunity, which is a PACE program. And as folks may know, Medicaid is a funder of long-term care and supportive services. We often think of Medicare as playing that role, but it is often the Medicaid programs that take that responsibility. So we absolutely are looking for those opportunities to address affordability.
And Edwin, as a policy institute and research, you know, we rely heavily on your data, on your analysis. How are you guys keeping up with all the changes happening, and how does innovation even impact the way you guys are informing the rest of all of us in terms of policy and research?
Yeah, I mean, I think there's been so much energy and activity on improving the Medicaid program, having more effective delivery of care, greater access to be provided to kids and families. And states have been at the forefront of that, state and local officials. And the worry here is that a lot of that innovation could be hamstrung just because of the big Medicaid cuts here. You know, I mentioned there are big restrictions on states' ability to use so-called provider taxes, which is a key revenue source. It's very technical, but these are taxes and assessments on hospitals, nursing homes, other providers that generate revenue for a state so that it can pay for its share of the cost of the Medicaid program. And with less provider taxes on the table, if a state can't identify other revenues elsewhere in the budget, it's going to have to make Medicaid cuts because states have to balance the budget, unlike the federal government. And the ability to innovate often requires investment, upfront dollars, so that you can produce savings, greater access down the road. And I worry about how this legislation could really stymie some of the innovation that states and localities have been pursuing and roll back some of the improvements that have been made in recent years. So it's going to be a very difficult task, and a lot of this is going to be sort of at the budget revenue level, but this it makes very clear that tax policy is health policy, because if we want to continue to innovate, improve healthcare access and delivery, we're going to have to invest. We can't cut back.
Well, thank you so much. And I'm going to provide some closing remarks. Thank you for everyone for staying. I know we went above the time, but this is such an important piece of information. And I'll just want to, provide some feedback here. The issue of the budget, and we're all living with that. And I think what's important is to keep in mind that these are people's lives. And it's really hard to think of someone being a, effective member of our society and community, and from children to adults, when you're not healthy. And children, at least in the state of Utah, #1 reason for missing school is a toothache, oral health. As simple as that, and that's what's keeping our children from excelling in education. So that correlation is real. Social determinants of health do impact the life of all of us, and certainly our constituents. So as we are in this process of finalizing this plenary session, I'm going to ask our panelists that were so gracious to provide a 1-minute thought as we end this piece. And I'll just end by saying, we just tap into the very, not very profound information. There's a lot on Medicaid, a lot of populations that are impacted. We didn't talk about individuals with intellectual disabilities. I mean, you have ICFIDs, hospitals, so many that will be impacted. But I'll say at the end of the day, we're all going to have to deal with it in our budgets, because those gaps have to be closed. I mean, the needs are there. The needs are not disappearing. And we also need to be better in articulating, I think, to our congressional delegations that impact and the human piece of this, which is very important. So I'll pass the time first to Kate, and just last remarks, 30 seconds to a minute. That would be great. Thank you.
Absolutely. I'll just say I was very inspired by what Cecilia said about long-term services and supports. At a time of significantly less financial resources for some states, expansion states in particular, I think it is incredibly important to look at opportunities to optimize state spending. Long-term services and supports is an incredible example. Older adults want to be at home in the community. They want to receive home and community-based services. We still have too great a proportion of people served in institutional environments. A non-exclusive example of something states can really look at in terms of accelerating, along with prescription drugs, along with systems costs that are within the control of states more than we may be considering. So just a reminder to look at those things over which there may be new opportunities.
Cecilia?
Thank you. I think the thing I would like to impress upon this group is that the timing of many of the provisions that we're talking about will not go into effect until after the midterms. So we may be up here analyzing, we're all digging into in real time in many ways, the bill still and CBO numbers that are still coming out. But the truth is that the changes will not be made until after the midterms. And so I want to make sure that this group is really aware that they need to be listening to your constituents who can bring you as much perspective as we can as we're learning about what needs to happen on the ground. But honestly, we'll be needing to really reflect on the provisions of the OBA for a few more years before we really understand the gravity of it.
Thank you. And Edwin, please.
Yeah, I'll just say two things. One, I think on Cecilia's point, outreach and education is going to be critical. There are people who think that they're losing their Medicaid coverage already, and being able to explain what these provisions actually do and how they're actually going to be effective is going to be critical to prevent a chilling effect, so the coverage losses are even greater than what's expected, because a lot of people think they've already lost their Medicaid coverage. And the other is that I mentioned earlier, there's a lot of sort of technical decisions that states need to make, and these kind of decisions, depending on how they go, can make the harm from this legislation less onerous, less draconian, and can mitigate some of the harm that's going to result. And I think that's going to be critical, and state and local officials are going to be absolutely essential in how this is implemented, and try to implement it in a way that's less harmful to kids and families who rely on Medicaid today.
Excellent. With that, that's a wrap up. Thank you, everyone, and have a beautiful rest of your day. Thank you. Thank you. That was perfect. That was really good. Thank you so much.
And now, please welcome back to the stage the Honorable Brian Colon.
¿A dónde va? ¿A dónde va, mi gente? ¿A dónde va? Don't go away. I got just a couple of quick announcements for you. And let me just say this. For those of you that have been in the room the last 20 minutes or so, con respeto, it was nice and quiet. All the people that were doing all that chisme in the back of the room, they left early. And then we provided real respect for our panelists, no? What a beautiful job our panelists did. Thank you so much. In terms of gratitude, also, not just for our panelists, but will you also help me give a little love and gratitude to the people, the mero mero cocineros and our servers today. They did a beautiful job making sure we had a delicious lunch. I'm very grateful to all our servers. So here are the couple announcements you have seen in your app. If you haven't downloaded the app, download it. For those of you who have used Whova in the past, this app to me is a little more nice. It's less clunky, easier to get through. So check out the app. But we have two very special offerings for members only. There are no guests permitted in these two panels, but this afternoon at 2:30 in Augusta A and B, we'll have the first of those two special sessions, and today's will be on the Supreme Court's birthright decision and a discussion surrounding that decision. Tomorrow we'll have a similar discussion at 2:30. That will be regarding Los Angeles and what we learned out of Los Angeles. So please check your conference schedule on the app for all those details, and make sure that you drop by those private sessions for NALEO members only. I also am very pleased to announce that this is really kind of breaking, very, very important. This is a development that just occurred. We received official confirmation today that United States Secretary of Labor, Lori Chavez de Reamer, will be joining us tomorrow morning in person for a keynote address. She is going to speak to Latina economic empowerment in our plenary discussion. So I am very grateful to have someone of her stature join us. And I know that we all know the Naleo way. We will greet her in the way in which she deserves to be greeted. It is a point of distinction and honor to have dignitaries, cabinet officials, senators, presidents, all having addressed Naleo over these decades and decades that we've been lifting up the Latino community. So this is one Latina we'll greet tomorrow. I hope you'll join me in doing that tomorrow morning at our plenary session. And with that, tonight, you are on your own in terms of what you want to do. I've already checked out where the cigar bars are. Wait, I'm supposed to be anti-tobacco. But there's some great dinner spots. But tomorrow night, we've got one of our major sponsors front and center. How about it for the world of Coca-Cola? We're gonna tear it up over there. We're gonna tear it up. And that's gonna be tomorrow night. So tomorrow morning, we will start at 8:30 in the morning. And so with that, I just want to close with one thought, and it really is kind of one of the highlights other than our beautiful panel. It is an inflection point for our organization. We've had decades of impact, and at this time when we need to have a voice and bring people in from the margins now more than ever, we're in a transition. The baton that has been held by our incredible leader, Arturo, and our new CEO, Erika, they've held that baton together as CEO and COO, and now it's been handed off. And we do that with so much love in our heart for Arturo. He's touched all of us. He mentioned my former Speaker of the House, Raymond Sanchez, who the award was named after today, and I know that Raymond is smiling. He's not as young as he once was, Arturo, but neither are you, right? He's smiling on you, and it's so well-deserved. And Erika, your team that is people that you and Arturo built together, you've presented us with a beautiful conference. We stand with you, beside you, behind you. Adelante, juntos. Gracias a todos. Hasta mañana en la mañana.